Hello, Tom Lebecki here with the New Theory Podcast. I'm hoping I pronounce it correctly. Today we have on the show Anna Villarreal, who is an entrepreneur and women's healthcare advocate working to use menstrual blood. Yes, you heard it correctly. Menstrual blood to early detect and track diseases. She started a company, Boston-based, Life Story Health, and she's actually working to develop other ways to blood diagnose test. Anna, welcome to the New Theory Podcast. How you doing today?
Good. Thank you for having me.
All right. So, as always, we like to start out. Tell us about your formative years and what makes you you.
All right. So I like to consider myself as a natural entrepreneur. This is my second company. And like a lot of other entrepreneurs, you use your life experience to start companies, which gives you the passion to continue to drive them. And that's how I started Life Story Health, through my own personal health scare. And over the last 3.5 years, it's brought me to where we are now.
Okay. What was the first company? And walk us through, did you exit? Did you fold it? Or is it still growing? You own a piece? What was your first company, and what was that exit like?
Just a little screen printing company while I was going to law school, and I did have an exit out of it, but seems like it's long ago.
Well, it's funny though, Anna. What my experience is starting to tell me is these smaller exits, or these first exits, are sometimes roll into much bigger one. So you know what? So that's awesome. So you had a screen printing business. You got out of that. Where did you grow up?
I'm from Austin, Texas.
Okay, so you're from Austin, Texas, and then you mentioned law school. So you're a lawyer?
I have legal training, but I would not ever call myself a lawyer because I never did much with it. I definitely am more in the entrepreneur bucket.
Okay, so you decided to go to, but you completed law school though, correct?
Yes.
Okay, which one?
Texas.
Okay, so UT Law School, you graduate with a law degree. What was your next step after that point?
So Life Story Health was shortly thereafter, which brought me to Boston, and I've been there ever since.
Okay, so you launched Life Story Health, and you mentioned you had a health scare, which I'm guessing is a catalyst as to why you started. Feel free to share that story for as much as you're comfortable with.
Yeah. So the blood source that only females can deliver is really what started all of this. I was having some reproductive issues, and I thought, why is there nothing that tests this blood source that might drive us closer to an answer, given that it's so proximal to the actual organs that are being affected? And that's really how it started. I started researching it and found that there was not a lot of research, and what there was definitely nothing that brought anything closer to a diagnostic in the space. And so the last 3 years have been me doing extensive research and testing to get us closer to hopefully a diagnostic for women-specific disease.
Okay, and where are you at with your funding, your setup, your development? Are you selling the product yet? Just walk us through kind of the funding heritage, and then where you're at in terms of product and sales.
Yeah, so we just recently secured a friends and family round.
Okay.
We're working with our advisors and our board to help guide kind of the pathway to bring us to the next level. But right now, our biggest focus is on the research that will guide our products and fuel our growth. So we just issued a couple more provisional patents on the research, but right now the research is really what's driving the company. And until we get to a better place there, more proof of concept, more phase ones, we'll be able to start talking products. But until then, it is all about the research and what it's putting out.
Okay. How much runway does a friends and family round get you?
Enough to get us through the proof of concept phase for a couple disease states.
Okay, and are you comfortable sharing what the round capped out at, or is that private?
That's private because I don't want it to influence my ability to raise additional funds later on as we continue to grow. So right now, I wanted to give us enough runway to make sure that the research could be completed at the rate that we wanted it to be completed at.
Okay, so it makes sense. All right, so you're raising some money. You had your friends and family around, and you're still doing some research and developing the POC, which makes sense, right? So why do PR? Are you still open to bringing money in, or are you closing it until you solidify? Do you know what maybe your Series A round looks like? How does that look like?
Yeah, it depends. That's a very big it depends question. It would really be very circumstantial on what the money coming in looks like and who it's attached to and what it's attached to.
Okay, so when you say Boston, is that just a name, or are you out of Boston?
No, I live in Boston.
Okay, now you're in arguably the most prestigious area in the world for this type of research. Are you hooked up with, or do you plan to get hooked up with any of the academic institutions there?
Yeah, so we currently spin all of our research out of Northeastern University, and we are continuing to partner to drive women's health research from universities outside of Boston.
Okay, so give us the because not the super high science. Let's keep it simple. How can we use our menses or female user menses to detect diseases? How does it work without giving away too much? And then what diseases can it track and or prevent?
Yeah, so we analyze menstrual blood for proteins found in that blood sort. What we know now, and again, we're still researching it, but what we know now is menstrual blood is fairly easy to collect in comparison to venous blood, so a blood draw. We have a robust technique to analyze the sample type, which we've won a couple awards for. And what we're starting to see is different post and co-translational modifications on pretty well-established proteins indicative of major disease states. The research is going to drive the initial disease states. The one that we've filed provisional patents on, I can't disclose right now because the patents aren't complete. But really, I think what we're going to see is there's all of these female prevalent disease that the medical and scientific community don't have a handle on why more women are affected. And that's really the platform that I'm trying to operate on right now, not necessarily the promotion of Life Story Health as a diagnostic company, but really to fuel the conversation around how much attention is given to women's health care and how we can improve it through different innovations like Life Story Health, but also sex-specific testing.
Okay, what products, and if there's none, what's the closest? What products are currently in the space? If not, what would be the closest competitor?
Yeah, so no products on menstrual blood as a diagnostic exist. The closest analogy that I could give you would be a blood draw. So the way that we would see something like this working is you go to the doctor, you present symptoms of a specific disease, and just like now when they give you a blood draw, you would get a kit that would allow you to collect your menstrual blood, and we would analyze it for what we feel is kind of the key to early detection of female prevalent disease.
Okay, so it's more of a preventative measure. So I'm a female. Your product's out, or I'm in your research trial. You take a blood sample, and then I'm assuming there's different markers. So what if it comes and says, "Hey Tom," or "Hey Thomasina, you come up for having a marker that may result in, I'm making this up, breast cancer or whatever the marker is." So what do you do? So then from there you change your lifestyle, you change your diet. Like you put a treatment plan in place to prevent. I hate to say this, but I get it, right? A pound of prevention is an ounce of prevention is better than a pound of cure. I'm with you on that. But what happens if it's like an unavoidable disease? Like, what do you do?
Yeah, so I look at this as a diagnostic. So it's not necessarily attributing your risk factor like, say, a genetic test.
Okay.
It's more about you you were either at risk to develop the disease based on the state of your metabolic system, or we're able to diagnose the disease earlier than what typically the gold standard is. So if you look at autoimmune disorders, for instance, women are 5 to 8 times more likely to get them, but it takes 3 to 5 years for a definitive diagnosis to occur. We think because autoimmune disorders are driven by estrogen, and the menstrual cycle is also driven by estrogen, that menstrual blood may hold a key to something that would be indicative of a much more accurate and early diagnosis for that disease.
Okay, that makes sense. Now, on the contrary, and I am not a scientist, but the contrary, does the composition of menstrual blood maybe give you information or do something that may throw off, because of that blood type or whatever the composition of it, that may throw off a test versus regular blood, and maybe you have to compensate for that? Does that make sense? I'm not sure if I'm asking the right question, but I'm guessing you're saying, hey, menstrual blood is different, therefore may pick up on things that regular blood tests may not, but conversely, can it trigger some things that may not necessarily be the case? And if so, can you compensate that in the reference ranges? Does that make sense?
Yeah. So and that makes a lot of sense, and that's down the line. Right now, we are looking at preliminary data that is providing clues to what we could find in menstrual blood, and all of that's going to be given through more proof of concept testing in phase 1s. But absolutely, as we get into more prime time with the data, we are going to have very high statistical significance to make sure that our accuracy, so the sensitivity and specificity of our tests are of course going to be in line with what the medical community would accept.
Okay.
But that's way down the line. So right now, really, I think where we're at in a company and where I'm at as a women's health advocate is to raise awareness for the issues of sex-specific testing, because right now it doesn't exist in the proportions that it should, and I think that's what's going to really fuel my growth right now. The data is going to come along as it comes along.
Okay. Where are you exactly at with the research? Have you started, in vitro trials? Are you in humans yet? Where are you at with your actual research?
We are in humans because that's who we collect the menstrual blood from right now to do the preliminary testing. I mentioned earlier we filed those provisional patents. In the next week or two, we'll be putting some studies into a larger studies design, and probably in August running more tests on a very specific disease state. Okay,
now in a perfect world, when would you like this to hit the market?
So we are already a year and a half earlier than I ever thought we would be, because, as I said, we're letting the research drive the company. And what we're finding early on was way more than anybody could have ever hoped for. So in a perfect world, you got to go through the FDA process and you got to do things correctly. So I would hope that we could have something in 2.5 to 3 years, but I'm learning this just as much as anybody else is, and this is an unprecedented blood source. It's a diagnostic that's never been done before, so I think we are going to have a lot of stringent criteria to meet.
Yeah, but it's also, I know in the drug space, if you're like an orphan drug, they will give you hopefully better consideration, and this is kind of quote unquote like an orphan testing method. This could be not just commercially huge, but more importantly, saving a lot of women's lives. Anna, you're impressive, and I'll tell you why. Many reasons. You went down the path, go to law school. You pivoted. You had one, I don't think any exit is ever small, but you said you define it as a small exit. And then now you got your friends and family on board, and now you're working to really, really make a difference. So, I'm impressed by it. And if you just want to maybe share, are you a millennial?
I am.
Okay.
I'm just on the verge, though, of not being one.
Got it. But nevertheless, I'm a millennial. Nevertheless, and that makes it even more impressive because you may be being a little bit more junior than the rest in terms of doing this kind of stuff. So share some parting thoughts, business, maybe some personal, and because you are an inspiration to anyone listening, especially those maybe younger female millennial entrepreneurs. So feel free to share some parting thoughts.
Yeah, and if you don't mind, I want to just give a couple statistics that I think will resonate with the audience, because that's typically gets people jazzed about the work that I'm doing when I tell them sort of the state of women's healthcare. And I'll start with very prevalent female disease, which is thyroid and cardiovascular disease. We know that cardiovascular disease is the #1 killer of women. More women than men die every year of it. But yet 1/3 of clinical trials have women. And out of those 1/3 of clinical trials, less than a third actually report the outcomes by sex. So I think it's really important for people to get a hold of where we are in the healthcare space, and what kind of challenges we have ahead of us and where the possible solutions are, which is Life Story Health. So I urge the audience to take control of some of this and do some research and get jazzed about what Life Story Health and the potential that it could be.
Wow. And with you at the helm as the entrepreneur driving the bus, there's no doubt you will. Let's just say you're an interested party, maybe a partner in terms of a device company, medical company, maybe an investor, or just frankly somebody who just wants to share their story. What's the best way to reach you, Anna?
You can find me on LinkedIn. Obviously request me as a friend. I'm super approachable. Send me an email. We'll have our website up soon, which will allow people to kind of get some of these stats that I've been throwing around. But for right now, connect with me on LinkedIn.
I love it. Anna, thank you so much for being on the show, and we'll have it up shortly. And I'm not going to say good luck because I don't think you need it, but I know you do a great job. So thank you for being on the show, and we're really proud of your efforts.
Thanks so much. Appreciate you having me.
Thank you. Okay.
Bye-bye.
Okay, Anna. Wait. Hold on 1 second.
Yes.
Okay. So I love what you're doing, and